Introduction to ICD-10-CM Coding Part 1. I'm going to take you guys all the way back to the beginning of ICD-10-CM. Okay, all the way back to the beginning. So make sure you guys watch this video, save this video, because you may need this information for the test, okay? Alrighty. So if you ever wondered, like, where did ICD come from? I'm going to tell you where it came from. Okay, so the International Classification of Diseases, which is known as ICD, is not a new invention. The classification system actually goes all the way back to the 1850s. Its earliest version was called the International List of Causes of Death, and it was introduced by the International Statistical Institute in 1893. When WHO was established in 1948, WHO took over the management of ICD and released the sixth revision, which for the first time included records of morbidity. In 1967, the World Health Assembly then mandated that all member countries use the most up-to-date ICD revision for reporting mortality and morbidity statistics. The 43rd World Health Assembly approved ICD-10 in May of 1990, and it was implemented by WHO member states by 1994. Now, mind you, though, the U.S. didn't actually use ICD-10-CM until October 1st, 2015. The purpose of ICD, a universal language for health. So ICD serves as a global standard for diagnosing and classifying all diseases and health-related conditions. For the public health, it assesses population health trends, it tracks disease frequency, and monitors mortality and morbidity. For healthcare, it supports clinical care, and it also serves a purpose for studying how often diseases occur in different groups of people and why. It also facilitates quality measurement. For administration, management reimbursement process, aids in resource planning and development of clinical guidelines. When COVID-19 first came out, it was so important that we coded ICD-10-CM codes for COVID-19 correctly, because they were using that data for so many purposes, and we were so important in that time for the reporting of COVID-19. A lot of the information that we sent out was what they were taking in consideration when it came, what they needed, the resources and so forth, how many people had it. That came from us coders. A lot of that information came from us. So we are very important people in this process of the data that we send, that we actually send out to the insurance companies and things like that, okay? We have important jobs. From data collection to global statistics, ICD is used to organize information, okay, on diseases and health conditions documented in numerous health and vital records such as death certificates. The key functions allows for efficient data storage, retrieval, and analysis, forms a foundation for national and international morbidity and mortality statistics, supports clinical care research and quality improvement efforts worldwide. As I mentioned before, coders are very important, and the information they report is very important. Make sure you're reporting properly because it affects a lot of data and things. So you want to make sure you take your job seriously. It's important, as you can see from the information on the screen. The U.S. adaptation ICD-10-CM. So in the United States, we have our own specific version of ICD-10-CM. It was developed to meet the country's clinical needs. It is known as ICD-10-CM, which CM stands for clinical modification. So for the U.S., we have ICD-10-CM, which is used for diagnosis reporting. And we also have another group of codes that are used for procedure and service reporting. So for example, if a patient comes in and they have a fracture, you're going to use ICD-10-CM to report that fracture. But if that fracture needs a repair, you're going to need to code for that repair. And you would use one of the other group of codes to code for that repair, depending on the setting, also depending on the insurance. So if you're looking over on the right hand side, you'll see a couple of the other types of sets of codes that are needed for this. You have the CPT and you have ICD-10 PCS, as well as HCPCS, which is not listed on the screen. They all can be used to report for procedures. Now, I'm not going to go into that deeply right now because, we're talking about ICD-10 and that's our focus. But we'll talk more about the procedural coding later. Just always remember that ICD-10-CM is used for diagnosis, and that is it. Nothing else. You will never report a procedure with the ICD-10-CM code. Key takeaways. ICD provides a global standard for classifying diseases with a history spanning over a century. It is fundamental for public health surveillance, healthcare administration, and clinical research. ICD-10-CM is the U.S.-specific clinical modification for reporting diagnoses. Medical procedures in the U.S. are coded separately using systems like CPT, and as I mentioned before, HCPCS and ICD-10 PCS.